medicine. Joining us in studio is our sports medicine doctor on the show, Dr. Joe Congeni, 1590 WAKR. Joe, we got to go back to the other night with Trevor Bauer. Goes 2/3 of an inning, has the cut on the pinky. He didn't think it would be a big issue. The wrap comes off because he's not allowed to have that on the mound. And within two batters, the blood just pouring out of the pinky. For his safety and others, he had to come out of the baseball game. So I guess take us to that. And we're no doctors. Tony and I were on the air yesterday saying the exertion and the fire in the hand, that thing was going to open up. I thought it was inevitable that it was going to open up. And now where are we with this injury?
Yeah, it's still a developing story because as we get into possible game 6 and 7 and possibly the World Series, is Trevor Bauer going to be back at all? So it's a developing story. It's a difficult story and hard to know. We all have learned a little about baseball rules through this. I consulted one of my emergency room doctors. Actually, my son is an ER doc down in Charleston, South Carolina. I called him up. He fixes these things all the time. You would normally put a pressure dressing on, but you can't play with a pressure dressing. I think we all learned that from baseball rules, baseball prohibits a pitcher from attaching anything to either hand or finger or wrist. A Band-Aid, tape, super glue, anything like that is illegal in this type of a situation. And so this would be rather easy to treat, even though it's a pretty big gash, if you were able to put a pressure dressing on it. What we do for somebody in any other sport is a pressure dressing applied over the stitches, and things would heal very well. In fact, later in the game in the dugout, you could see he had a pressure dressing on it, but no pressure dressing allowed. The other thing you'd do is you'd probably get your best plastic surgeon, if this was me in town, to try to put as many sutures as possible. So typically something like this would only require maybe 6 or 8 sutures, but 10, 12, whatever, you'd really want to try to put the sutures on. There's going to be, in a baseball pitcher, a lot of pressure on that. You know, we called it a laceration. It is more like a gash. It's pretty wide, and that's what makes it really difficult. It's not just a thin laceration. It's going to be tough to get it to heal. You know, the other things that we typically do in medicine, a lot of people have talked about the super glue in emergency room. It's called Dermabond, and a lot of the lacerations that we use would use super glue. And maybe in a case like this, typically you'd use super glue early on along with to augment the sutures. As my son said, that is not allowed in this situation. If somebody was bleeding like that, you might use a topical called silver nitrate, which stops the bleeding. Or in surgery, we cauterize these kinds of things to stop the bleeding. None of that is allowed with baseball. Whether those rules will be revisited after something like this or they're appropriate here, I don't know. But very simply, a pressure dressing would take care of the whole thing, but it's not allowed. So we go back to square one now, I think.
That's what I was going to ask. Where are we? I know you're not looking at it in front of you, so that's tough to do. But from what happened in the game, you're telling me he's back to square one.
It's a pretty significant setback. It looks like a pretty wide gash that he has. And by what he did with it the other night on Monday night, reopening it again, rehealing is going to have to take place, and I think it's going to have to be a longer period of time than they tried already.
What's a longer period of time?
A longer period of time is the $1,000 question. I'm not paid enough to answer those, Ray.
Shoot, I thought I was going to get an answer, man.
I think it'd be pretty hard to get him back in game 6 or 7 of this series.
That's what I was thinking.
I think he's a real possibility for the World Series. I think with Tito, who looks at all these things in great detail, he's trying to make those decisions now. He's got Salazar possibly in the wings, and he'll look at it that way. But I think it's going to be hard by looking at that thing to get it to heal enough for game 6 and 7, which is just Friday and Saturday of this week.
I went through, I'm not going to compare it all, but my son Rocco slit his finger during the baseball season. I don't know if you remember me telling you that or not. And it was on his throwing finger on his hand. Now, he's not a pitcher. He's not a major league ball player. But I remember when he got that cut, I didn't think it would keep him out much. He got the stitches and everything. He came back 3 or 4 days later and tried to play, and it busted open and started to blood. So we kind of shut him down. Now, he could swing the bat and put a batting glove on. So that's not being a major league pitcher. And I remember it took him 2 weeks or so before really he was able to get it and throw it back and have very little discomfort. We're talking about a major league pitcher's hand who continues to get the snapping and the turning and the sensation. And because he's not allowed to have that wrap on the mound, that's a big disadvantage in healing, isn't it, Joe?
Yeah, it is. And I saw somebody with a laceration yesterday in my clinic, and I would normally tell them 7 to 10 weeks. Now, under the pressure of gripping a baseball, you're going to put that thing at more risk, and it probably increases things to closer to 2 weeks or even a little bit longer than 2 weeks. And so obviously trying to get him back sooner than that didn't work. I think we're looking at into the World Series if we're fortunate enough to get there.
Now, let me ask you this. Let's say, and he, I'm sure, does this morning, he's got the pressure wrap on today, and maybe they've got a plastic surgeon and doing all the other things on these off days. Is there any way that that thing could heal enough for him maybe to come back this weekend or game 1 or 2 of the World Series?
I think there is in the World Series. I think for Thursday,
you don't think this
possible
weekend?
Thursday or Friday of this week, I think it's pretty unlikely. Okay. And I think it was reflected in who Tito started. I think he's got himself set up for Tomlin and Kluber on Saturday, Friday and Saturday.
I think that's why he went with Kluber yesterday.
Yes,
I think
so.
He wanted to seal the deal yesterday.
I think he knows that. Yeah,
get that thing done. Okay, let's go to the Cleveland Browns and let's talk about the young man Poyer. He took a vicious block.
Yeah.
I don't know, in today's day and age, it was ruled illegal, but it was a hard hit block from the blind side, and that's now illegal. He's got a lacerated kidney.
Yep, it was.
And we hear the term, but talk about what this means.
Yeah, it was a decleater. He was lifted off the ground, hit blindsided on a peel back block, they call it, and not the classic mechanism of a kidney laceration,
right.
But that is an injury that we worry about on the field. Geez, if you follow the Cleveland Browns and you're a sports medicine person, you can see an anatomy all over the field. I mean, just think of all the anatomical areas we've learned about just seeing the Browns this season. We have a lung contusion, and we have a odd injury of the fracture of the shoulder called a coracoid. Now we have a kidney laceration. We look for these all the time on Friday nights, on weekends when we're covering sporting events. People that get a hit usually to the flank and back. And flank pain can be an injury to the kidney and some bleeding in the kidney. So you actually, obviously we tell kids, watch your urine over the course of the next week, after the course of the next few days. And if you see anything, darkened urine, redness in the urine, we're going to have to check that out and check out. But then of the kidney injuries, there can be kidney contusions, just a bruise. You can kind of tear the covering of the kidney, or you can actually kind of fracture or what's called a laceration, and that's obviously the most serious. He spent time in the hospital. He's just coming back now, and early reports are he may not play at all again this season.
Wow. Okay. Now, on a football-related note, just down the road, Ben Roethlisberger, they're saying knee surgery, but not season-ending, and they're saying just a couple of weeks.
Could we please talk about another group of quarterbacks? Please, please. And so our rival that a lot of people turn to, and so Ben has been so banged up so many times. He's had multiple surgeries. People that have, this is more something, I was thinking driving in, something I see more in, seeing adult patients and hear about seeing adult patients. But we do see it in kids. There's some kids who have torn cartilage before. There will be a piece that catches or tears again, and they go back in and clean up that loose piece that's in the knee. In fact, that's kind of the way Charlie Whitehurst looked on his injury. I never heard exactly what Whitehurst had, but remember, he just got tripped up, got his knee twisted in a funny way, and that's exactly, I saw the mechanism of Ben's. He got his knee twisted in a funny way. It didn't look terrible or anything, but what happens when you've been in there before and had surgery before, you break loose one of those pieces of cartilage and you have to trim out more cartilage. For the long run of the knee, you're losing that important cartilage pad that supports and protects the knee, and it's not so great for arthritis. For the short run, people get back to play pretty quick, and with his track record and things, I don't think he'll miss too many games. I did see he was ruled out for New England this week, but I don't think you're going to miss too many weeks with a clean-out surgery of his knee arthroscopically.
I want to get back to the Indians right now. You're pretty much tuned in with the sports medicine. What are you hearing about Danny Salazar?
All I hear and believe fully is what I read and hear from Tito, and he said that he had a simulated game at the Rogers Center in Toronto. Why they did it up there instead of beautiful Northeast Ohio. They had him up there with the team. He had a simulated game. If you saw, they actually showed some footage of some of our long relievers did simulated games because they hadn't pitched in so long.
Right.
In Salazar's case in the simulated game, he said he had the power back and was actually throwing up with the velocity, which was good, but maybe even more important to Tito, he was able to throw his off-speed pitches. So he's right about in that middle of what I told you I battle with all summer long when I tell position players 2 or 3 weeks, then another 2 or 3 weeks for a pitcher. It's going to be about 4 or 5 weeks before you're ready. That's right in the wheelhouse of the World Series if we get there. And I think there's a realistic chance that he does some spot relieving in the World Series, Danny Salazar, if he continues to get his velocity back.
All right. Great insight, Joe. Thanks for coming in.
All right. Thanks, Ray.
All right. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital.